The World Health Organization estimates 10% of the world's population has a disability. By 2050, there will be 900 million deaf people globally. People with a hearing impairment battle with communication barriers to demand and receive sexual reproductive health information and services. If they do, they are often perceived as often inadequate or ethically inappropriate.
Ukabona ufite ubutumwa utavuga aje gusaba serivisi kwa muganga. Ni gute wabubwira ngo ihangane ari manyibi avuka ihangane umubwira ngo icara ugateka hasi yego yaba yagize ibyago cyane kumubwira ngo komera wamubwira gute yego
Since 2007, VSO, supported by the Department for International Development (DFID), is running a project dubbed Imbereheza in Nyagatare district. The project aims at improving quality adolescent sexual reproductive health information and services to deaf adolescents and youth aged 15 to 24. This is done through the provision of basic sign language training offered to nurses and community health workers to break the communication barrier between deaf and service providers.
One pillar is empowering young people about information, so they have the right information that makes them to make, best choices or informed choices regarding sexual reproductive health. Then the other is around engaging nurses and community health workers to gain confidence to be able to deliver sexual reproductive health information and services to the young people within health facilities, but also within the communities. So the other part we are looking at is working with parents through parental dialogue. How can we improve communication with their children? And so far, what we are doing, so we are training health workers to be able to communicate to the young people. We are engaging parents through theater activities or drama to be able to dialogue with young people, and then we are really having debates and talks and information sharing with young people to make sure that they have such information that is relevant and appropriate to them.
The situation is alarming because these young deaf girls are not educated and informed about their reproductive health and body changes. The parents do not know how to communicate with them. As a result, people will take advantage of that, and you will see some of them being sexually abused because they're not equipped with the right information to protect themselves. They also need health services from a health center as any other person. For example, they may need medical consultation. Others are women who may get pregnant, or they may even need family planning services. Before our health workers get trained, we were not able to serve them as well as the rest of the community because we did not have the right skills to communicate in sign language. Before, we used to fear them, and they were also not comfortable coming to the health center, knowing that we will not be able to communicate. Now that we have been trained, our health workers here at the center and in any other health center in Nyagatare district are more confident and can take good care of deaf persons. The sign language training came at the right time. We had 5 deaf women under the family planning services, and to find out which method they would like to use was a challenge. We tried to guess and chose for them. As soon as we had the training, we visited them and were happy to have a conversation in sign language, through which we were informed that the method we gave them wasn't of their choice. and this was addressed during the next appointment.
Twaje muri aya mahugurwa y'ababana n'ubumuga bwo kutumva no kutavuga kugira ngo dushobore gufasha bariya bantu babanaga n'ubumuga bwo kutumva no kutavuga kugira ngo tujye dushobora kubafasha mu buzima bwabo bwa buri gihe, kuko wasangaga akenshi hari ibibazo bahura nabyo ugasanga ntibafite uburyo byakemurwa kubera ko nta muntu n'umwe waruzi ururimi rw'amarenga.
Our health program targets youth and adolescents. So in terms of addressing sexual reproductive health issues or challenges for young people. So our targets are too broad. So we have the very young adolescents, that's 10 to 14. And these are adolescents within schools, so the primary schools, if I would say. And then we have old adolescents and youth. Those are people between 15 and 24 years, and these are basically out of school youth and young people. So those are our broad categories that we work with. So in Rwanda, we are basically in the two districts, that is Kicukiro, where we are focusing on the young adolescents, 10 to 14, and then in Nyagatare district, we are targeting out of school adolescents, and basically in this year, we are really focusing much on deaf youth.
So we are focusing, for example, on the youth deaf and health, because what we realize is the issue that we have in sexual reproductive health is that the children don't have the information. So we're finding a way to give them the information. But then when you are tackling issue of disability of deaf with the deaf community, it's very difficult. When they go to the health centers, the health workers don't know how to communicate with them because they don't understand the basic sign language. So that's what we're doing. We're trying to help the health centers, the health workers to understand a bit better the sign language so that they can be more receptive to issues brought by the deaf community. But on the other side, as I said earlier, we realized very clearly that the youth between 10 and 14, 15 don't necessarily have the information on sexual reproductive health. So that makes them more vulnerable to sexual reproductive health issues. So these are issues that we are tackling in our programming.